Welcome, friends, and thank you for tuning in to another episode of the Optimal Health Program. Today we have a lot to talk about. We've got some great emails from people going to hit the website, and our website views are going completely through the roof, which is what we love. I speak with Kristen all the time, who is running and fine-tuning the website, and her group has done a really terrific job making it look exciting, interesting, warm, inviting, which is, of course, what you'd want a website to look like. So we're tracking the number of people that are calling the office as well, and it's amazing to see. We had a few hundred over the weekend, and I think in part from doing the programs here Monday, Friday, and Saturday, especially Saturday, I think people are home and just kind of waiting to listen and look and learn, and they just ask a ton of questions. So we'll go over those questions in just a minute. I have a lot of great research to talk about, and I'll just give you the titles for the moment, and then we'll work our way through this. The association between antioxidants and stroke. The lower the antioxidant vitamins, the higher the risk of stroke. Makes a lot of sense because free radical damage and reactive oxygen species and a lot of different inflammatory concerns occur when your vitamin levels are low. So that's easy to understand, but we'll chat about that. Also, micronutrient deficiencies and heart failure. Your heart muscles need vitamins, minerals, hormones, all these great things to work. So when the nutrients aren't there, free radical damage occurs, and this sets the stage for heart failure. Some research on vitamin D status and colon cancer risk. When people have low vitamin D, they have an increased risk of just about every cancer. And this is a great study talking about vitamin D deficiency. And many of you know, when you go to your doctor, you might need to ask for vitamin blood tests because they don't typically do them, but you might need to ask for vitamin D levels, and most people are, under 30. And you really want to be in a great range between 80 to 100, because that's where you get your best protection for your bones, your best immune benefit, your best anti-cancer benefit. Another comment on vitamin D decreasing breast cancer risk, yet another study. We'll talk about hypothyroidism today because this is an extremely common topic. We'll talk about testosterone deficiency, female hormone deficiency. It seems that every day I have at least a handful of patients that are talking about the symptoms that correlate with hormone decline. And if you look at people that come to the office, there are a lot of people that have high cholesterol and have issues with weight. But more people, probably 75 to 85% of people I see have some evidence of hormone decline, either symptomatically or based upon blood test. So the conversation about hormone correction, we talk about with every patient every day. Okay, phone lines are open. If you'd like to call in to ask a question, you could do so now. 888-420-9272. 888-420-9272. And we'll get your questions up on the air. Let's go first to a email from Tom, who's in Westchester. And he wants to know about testosterone therapy and testosterone replacement. How do you start? Well, testosterone is a very important hormone for men and women. It does a variety of things. It's good for bone stability and strength, sexual drive and function for men and women. You don't see that many men that have bone degeneration because they have higher levels of testosterone compared to women. But we see a lot of osteoporosis in women, partially because estrogen drops down and calcium starts to come off the bone. But the testosterone decline, which can happen early on, is also part of that. So when we want to correct bone stability and strength, we talk about correcting estrogen, progesterone, testosterone. For a lot of women, we give them testosterone pellet. You take it under the tongue sublingually once a day in the morning, and your levels come up, and you do really well with that. But for men, testosterone therapy in the past has always been, patches, sticky patches you'd put on your body all over the place. It, was really uncomfortable. Most people didn't like that. So what we do now is initially give a testosterone shot, 200 milligrams per ml, once a week over the course of 3 to 4 weeks. As your levels come up nicely from that shot, again, it's 200 milligrams, and that sits in your muscle, gets distributed to your body throughout the day as you move around and do your activity, and of course, as you do your exercise, that will start to feed your cells and meet that requirement. So it decreases anxiety, irritability that comes from testosterone deficiency, enhances sexual drive and function. A lot of men that have testosterone deficiency lose the hair on the lower part of their legs. So there are a wide range of different symptoms that correlate with that. But as we track patients week to week, we want to see how much improvement they have in that list of symptoms or list of abnormal symptoms that they have, which we've correlated with the deficiency. And because a testosterone shot will last about a week, week and a half, and we overlap it by doing the shot once a week, you can see the blood levels come up to a very good range, about that 700 range. And I tell men, well, that's where you should be. For women, it's probably 40 to 50 on their blood test. And as those symptoms start to go away and they feel good, the option could be continuing some of those shots. But in many cases, men will either do a pellet under the tongue once a day at 40 milligrams sublingually, and they do that every day at home. Other people may opt to do cream or gel, which can work just as well. And the slightly newer technique is using pellets that you place under your skin. So we can do that as well, where we take testosterone pellets the size of like a grain of rice, and one of the pellets that's a quick-releasing pellet is like the size of a piece of black pepper that you would grind and put on your food. So small pellets, and those will sit there for about 4 to 6 months. So that's your therapy. You do that once over the course of about 6 months. And we track and maintain and check your blood levels every month to make sure you're in the right range. So, and for women, it's typically sublingual. Some women also opt to do estrogen replacement or progesterone replacement. That can be done through pellet as well, and could also use the testosterone pellets in small doses for women. So there's sort of a new era of coming in and getting a procedure done. It takes 5 minutes, very simple, very quick, and you're good for 4, 5, or 6 months. So that's the best and the latest state of the art for correcting the thyroid. Any calls yet?
Just a question first.
Yes.
I had a caller waiting, but I guess they weren't so patient. But how do you correct osteoporosis of the skull? That's what I got on YouTube.
Of the skull?
Yes.
Interesting. So osteoporosis usually occurs, and testing is done for the lumbar spine, the neck of the femur, the ball and socket. Your hip socket is made of that ball articulating with the acetabulum, that neck, and then the femur bone going down your leg. They may also do the wrist, the radius. So usually people that have osteoporosis have it there. Curious to see or know why a person would have osteoporosis of the skull, I'd need a little bit more information on that, which is a terrific question to ask. But osteoporosis we work on from every part of the picture. So you want to correct vitamin D levels? Absolutely. You want to correct all your B vitamins, your calcium, magnesium, potassium. You want to make sure your testosterone levels are good, man or woman. IGF-I, the active component of growth hormone, which helps to repair your cells, is important because metabolically it works just about on every tissue and every cell. Physical exercise and activity is important, especially when you're tugging on your bones. Doing weight resistance training will probably do more for your bones than just doing some cardiac activity. So there are a variety of different things that I think work well for your bone. Boron is another nutrient that's used.
So they're actively responding. They say Dr. Joel Wallach says most people have osteoporosis of the skull and don't know it, a vitamin deficiency.
Well, it may very well be that because typical testing is not done for looking at osteoporosis of the skull. As I say, the bone density tests are all the back, the hip, and the arm. You could do an x-ray of the skull and look for that. I don't think it could occur in the skull without occurring in other bones of your body. So you could, and certainly may make sense to ask and have doctors test for x-ray of the skull to look at the skull as well. So not a bad idea. But it's not only vitamin deficiency. Osteoporosis is not a vitamin deficiency phenomenon. Primarily for women, it's estrogen loss, where you lose calcium off the bone as you start to get older. And same thing with testosterone. For men that don't have osteoporosis in the rates that women do, it's testosterone decline. And of course, as I just mentioned, you want to use a variety of nutrients because they certainly help, but the cause is more hormone-related than almost anything else.
Got it. And then I have on Instagram, I have a Joe saying he wishes he could call, but he is at work, but he asks...
well, thank him.
He said, does he recommend BCP 157 and who should or should not take it?
So there are peptides that are very good for your system. And these are proteins, they're not drugs, that have beneficial effect on improving your body function. The most common one that everybody asks for is NAD. And NAD is super important because it's responsible for conversion of oxygen to 36 molecules of ATP. If you think back to high school chemistry or biology, oxygen needs to go through a bunch of steps to get to ATP, which is your energy molecule, and NAD, nicotine adenine dinucleotide, is the one that does that. So when NAD became available, and when compounding pharmacies make this into an injectable, where you're getting absolute pure NAD, people see a significant improvement in memory, focus, concentration, word retrieval, mood, the ability to get up and go. They just, you're like your 20, 30-year-old kid again, and you're just ready to go. And feedback on NAD has been pretty dramatic, and I have thousands of patients that do the NAD. Other peptides include BPC 157, which is supposed to be beneficial for decreasing inflammation, but that's a little harder to get response from because people say, well, BPC 157, I heard about it, it's amazing. And some people will get it online because it's a capsule you can take. Some vitamin manufacturers are making it, but for me, it's hard to see and measure because people may take it and say, I don't really feel anything. I said, well, what do you have that you're trying to change? So people that just randomly take it don't come to me and say, well, it did this or did that. Well, if you have an inflammatory condition, you have a high C-reactive protein, or you have inflammation in your soft tissue or your knee, and you took it and you got some result from it, great. You can say, all right, my C-reactive protein's decreased, my inflammation in the soft tissue or my joint has gone down. But it's one of those things that's a little bit nebulous. The other thing we do a lot of is Samlund, which is getting your body to make your own IGF-I, which is the active component of growth hormone. And IGF-I is a critically important process. It's a step in the process to repair your cells. So IGF-I, again, growth hormone in your body has to become IGF-I to work. So if your IGF-I levels are low in the 100 range or less, and they should be at the 300 range, correcting what you've always had for the IGF-I makes a very big difference. Most people, they say it improves their hair, their skin, their nails. They grow faster. Men don't like the idea that they got to trim their toenails and fingernails all the time because we're not used to that. We don't ever think about that or get your hair cut more often. But sleep is dramatically improved with IGF-I. Memory, focus, concentration, mood, sexual drive and function, fat burning, cholesterol burning, endurance and stamina and strength with exercise. It has anti-anxiety and antidepressive effects or benefits, but this is a hormone you've had since you were conceived. So if your levels were great when you were a kid and a young adult, and if you had gigantic levels and you're 6'7" or taller, that means your bones grew longer from the IGF-I in the formative years up until maybe 18 or 19 or 20. People that don't have enough usually are shorter in stature, but the individuals that have a lot of it do extremely well. And as you get older and those levels drop, you start to suffer from those things. And you're not sleeping as well, your memory, your focus, mood, anxiety, all these things can pop in. And when you look at that level on the blood test and you correct it, and then people say all of these things are reversing, there's a science for that. So the BPC, I think people can take it if they want, but you've got to have a reason to take it, and you've got to be tracking what it's doing for you.
Got it. We got another one from YouTube. I would like to know about kidney regeneration. I had end-stage renal failure, dialysis for 3 months, now off dialysis, now stage 3 CKD, nephron damage from naproxen.
Okay, so the only thing that's going to give you new kidney cells and repair and correct kidney function is stem cell therapy. I've been talking about this for over a decade now and doing it for patients. The way stem cells work is we take your stem cells from your body, the crest of the ilium, which is a little further back from where your belt sits on your iliac crest, and that goes down a bit to become a little bump at the end of that crest. To the middle of that crest is a dimple in your low back. To the right is your glute muscle, your butt muscle. And we sterilize, numb the area, extract, take about 60 cc's of fluid, which is bone marrow, through a little bit of a pinhole, It takes a minute and a half. We spin it for a half hour, separating red blood cells, then plasma and stem in that sequence out of the centrifuge vial. We take out the stem cells, and we can then take those and put those either into a joint, anywhere to create repair, intravenously to go to all your organs. We could add a nebulizer to give a double dose to your lungs, or drip it intranasally so it gets to the back of your nasal cavity into your brain. And you could look at the videos here on the podcast, on YouTube. You could look at the website, drcalapai.com, and you'll see a ton of videos of patients with all sorts of diseases, MS, Parkinson's, stroke, diabetes reversal, etc., where stem cell therapy works. It will go where the damage is because of chemical signaling, messaging, and put brand new stem cells that become kidney cells to that site. So there's no drug that gives you new kidney cells. There's no drug that changes and raises your GFR, but your filtration increases and your creatinine decreases. And we have evidence of patients that we've seen that. Just like it would work for your heart, your brain, your liver, your lungs, your kidneys, every other part of your body. But yeah, the evidence there is on the website.
We got questions flooding in.
Excellent.
Okay, where do we start? You mentioned this is going to be good for Friday, but this person doesn't know that. You mentioned last week the harms of wine from California and other places in the United States. Are there any safe areas to buy from in the U.S.?
So yeah, there are, and there are probably many places to buy from that take the extra step of making sure that the earth that they grow the wine in is in wonderful condition, that there's no heavy metals, no chemicals, etc. And they're not using pesticides to spray. There are more natural means to help to keep bugs off the grapes. But there were 30 vineyards, and I remember seeing this on the Today Show years ago, that were investigated for too much arsenic in their wine because they were spraying arsenic on the vineyard to, kill the bugs or germs that would destroy the crop. Apropos to the comment before we started the show today, a good friend of mine, Anthony Sanino, I'm going to have him on the show on Friday, and we're going to talk about winemaking, which is a huge amount of fun. Now, I'm not a big drinker, and all my friends that know me, I don't drink a lot. I'll have a really good glass of wine with dinner, and I'll go out to the vineyard and do the harvest and have a wonderful time out there with my friends. But it's really amazing to know how the process is done, how it should be done the right way. So I think in some facilities, they are cutting corners. I think in some facilities, they're skipping some steps and whatever else. But that's, hard to say. But again, go online and look at California wines and arsenic. So some of these wines, and I'm not going to name them, but some of these wines you'll find online are very common names, and they're inexpensive wines, and they're in a lot of the stores. I think you're better off with either Italian or French wines. Some of the South American wines from Chile also had some arsenic in it. That came up in a recent study. But you've got to do your due diligence and look at the vineyards, look at the companies. The interesting thing, and I took a great wine course locally in Oyster Bay at a facility, a wine bar called the Audrey. And the gentleman James that gave the wine course is an attorney, and he teaches, wine courses at all the colleges across the country. Extremely intelligent guy. We had the greatest time listening to him. So here in the U.S., vineyards can grow multiple wines in the same soil. In Europe, in France, and Italy, they don't do that. So in Burgundy, they grow 2 grapes on the vineyard for hundreds and hundreds and maybe more, years. And the strict nature of what they do in Italy and France, you'd have to reach the highest quality of standardization is having DOC or DOCG on the label. So that means an outside agency says that's absolutely the best and purest manufacture of those wines. So little tidbits of information here or there. I tell everybody, go take a wine course. I think wine is great for you. The antioxidants are good. You can't go crazy with it, but, a glass of wine with dinner, and even if you do it every day would be fine. But it's fun to see how that process is done. I even told Frank and Sabrina one day, and the weather's nice, we'll go out and we'll do a show out from the vineyard. It's gorgeous property. You really think you're in Tuscany.
Can't wait
because you
for
can't
that.
see beyond the vineyard because it's so big. You sit out there, you relax, you have a glass of wine, have some food, but it's a wonderful process. And there's a lot that goes into it. To give you a little bit of a tidbit on it, when you cut the grapes off the vine and you have that cluster of grapes, you put them into a big basket, then it goes to a destemmer, which is the device you put the grapes into. It starts to move it with these big paddles that flop around. You're pushing the stem out of one side of the machine, and then the grapes are crushed, and that juice and the skin go out the other side into big containers. And then you keep pushing down the cap or the skin, and then more crushing of the skin to get, more flavor and more, alcohol from the wine. It's a great process, but we'll be talking about that pretty soon. But yeah, look at the company that makes the wine and look to see what their standards are, because you certainly want to make sure you're not getting anything that you don't want in the wine.
Very interesting. Yeah, me and Sabrina on our honeymoon, we got to, go through Tuscany and truly see, what is involved in like the love and care, just hundreds of years of tradition and just
thousands.
Thousands.
Yeah. It's a religion as much as religion is. And I have a good friend of mine I went out to dinner with the other night, my friend Charles, who is, he's a blast. And so we're talking about, we have to get we had some great wine at a local restaurant that I love called Opus. It's one of the Scotto restaurants, and it is impeccable food. The wine is great.
We're fans.
Yeah,
right?
So, he's a wonderful restaurateur. He's got so many restaurants, but the service is impeccable. The people are impeccable. The gentleman who's a friend of mine who manages all of them, Rich, terrific, terrific guy. And we had 2 bottles of wine with the group. But what they do on Fridays at that restaurant is that any bottle of wine over $150 is half off. So, we took advantage of that. We had one terrific French wine and one terrific Italian wine, a Super Tuscan. So, but it's attention to detail. You have to pay attention to detail with vitamins you're taking, where you're going to go eat, what food you're going to purchase to make it home, what wine you're going to drink, and where you're going to go to eat, what restaurant. It's all attention to detail. So, yeah, good stuff.
YouTube is popping off.
Really? More YouTube?
I know. People, they say that the new generation, they're scared of the cell phones. That's what they're scared to talk. I just read an article today.
Yeah.
Said the new generations, they're scared.
It's possible. I don't know. I'm sort of seeing and learning all of this stuff as we go, and it's fascinating to me. And I understand, the trepidation that people have in using their phones, because every time you talk about something, let's say we're talking about a car or a waffle maker, anything at all, and within 2 to 3 minutes you see an ad for the car or the waffle maker on your phone, your phone's listening to your conversations. Yeah. So.
Doctor, you were telling me about this thing you stamp with some money sometimes. It was a little toy you told me about, and you left the studio, and I immediately got an ad for it. Yep. I'm not kidding.
Yep. The phones are tracking, and this is what their whole purpose has always been, tracking and so does Alexa. They're tracking your comments, and they're trying to send you things to try to get you to buy things that you're talking about. So it's a constant marketing mechanism, besides the fact that nefarious people, I think, that were in government, that I think they're going to be out of government now, are tracking certain people's cell phones and everything they're doing. I have a friend that just bought Faraday bags, and these are bags you put your cell phone into, and no one can access that. Not a bad idea to get a bag, pop your cell phone in it, pop your computer in it, and you're off. No one can see what you're doing or know what you're doing. So,
yeah,
shame it's come to that, but it's a little scary.
We got questions on YouTube.
All right, the YouTubers.
So,
awesome.
I have a question about high cholesterol. I'm 29 years old, fit, and take care of myself. I eat the right things for the most part. However, the last 2 years in a row, last 2 years in a row, both fasted blood work, I have shown that my cholesterol is high, and this past year was higher. Is this something genetic or cause for concern, and when do I need to start worrying about it?
It's a really good multiple question. I'll create multiple answers for that. So if something's genetic, then you really can't change that thing. If you have brown eyes, or I have brown eyes because my dad and my mom did, I can't change the color of my eyes. Same thing with hair, except for people that, would like to color their hair, et cetera. Or how much you look like your mom or your dad, you can't change that. But if I can change anyone's cholesterol, whether it's genetic or in the family or not, then it's a changeable mechanism. It's not something that is completely unchangeable or written in stone. So for people that have high cholesterol, in most cases, from what I see, and I do 5 or so different things to bring down the cholesterol, either eating too much carbohydrate. Now, carbohydrate doesn't have cholesterol in it, but the more carb or sugar, fruit, bread, pasta, potatoes, rice, oatmeal, grains that you have, you're putting all of that in the way of your body reaching that cholesterol to burn it as a fuel. And every diet now that works is a low-carb diet. So the low-carb diets, when you're taking out the sugary things, tell your body, okay, there's no sugar there. What are you going to do? Your body says, well, I'm going to burn fat. So the first fat that you burn are triglycerides, which are sugars and fats in your blood. They'll plummet within the day. And then with the next couple of days, you start to see the cholesterol come down. So low-carb diet is wonderful for lowering cholesterol, number one. Number two, exercise. You want to do at least a half hour a day, in a perfect world, 45 minutes to an hour, of a nonstop activity. Indoor bike, outdoor bike, elliptical treadmill, go to the gym, yoga, Pilates, anything you like, but a half hour of something every day nonstop. People say, well, I walk the dog. Yeah, I said, if you walk the dog like I walk my dog is pulling me because she's so big, and she stops whenever she wants to smell something, but that's like every 3 feet. So I'll get 3 feet and stop, 3 feet and stop. At this point, I just take her off leash and just say, do whatever you want. And I'll walk and continue to do the activity. But dog walking is not constant because there is a stop. The other type of exercise and walking, per se, would be if you're walking around your block, go to the first corner slow, warm up, stretch out, then brisk to the next corner, then fast. Slow, brisk, fast, brisk, fast, brisk, fast, brisk, fast, fast, fast. So as you do this and you're changing the speed, the intensity of the activity, you get a much better cholesterol, sugar, fat burning. Third thing is to look at your hormone levels, because even patients I've seen that are in their late teens, 18, 19, 20, have had low thyroid. We picked that up by doing a T3 thyroid test, but traditional doctors only do T4 and TSH, so they miss that. The full thyroid panel that I do is T3, T4, TSH, T3, T4 uptake, free T3, free T4, reverse T3. We're also looking at thyroid antibodies, thyroglobulin, etc. So it's about a dozen things we look at for thyroid. If your T3 is low, you have to act upon fixing that as your TSH also goes up. So low-carb exercise correcting thyroid. You could also correct testosterone, DHEA, IGF-I if they're low. So, and vitamins help to lower cholesterol. So there are natural things we do, and your body can't escape those 4 to 5 different things that we do to burn down your cholesterol. So we don't use meds for that. Berbeриne's good to lower it. Red yeast rice is good to lower it. So there are a variety of different things that you can do. And sometimes you might be just on the cusp of one of these recommendations. Maybe you have to drop your carbs another 10, 20%, or kick up the exercise 10, 20%, and the result is there. So there are a lot of people that are just about there, but you just got to fix a little bit more. That's like saying a person who's got a thyroid level, a T3 of 70, when 68 or 69 is low. 70 looks like it's normal, and the T4 is 6, but 5.4 is low. They're just above being low. If you bring them to the middle of the range of the T3 and the T4, and all of a sudden they have better memory, focus, energy, they're doing exercise, getting more result, burning the fat better, you might need to just correct those things to the middle range. Good questions.
We got more.
Okay.
I'm about to be 30, and prior to having children, I had no health issues. My boys are 11 months and 25 days apart. My eldest is 20 months old. A month after my first son was born, I started to develop eczema on my hands and arms, which went away when I became pregnant again. About 2 months after my youngest was born, the eczema came back and became much more severe, making my hands extremely swollen, hard to touch things, and care for my children. Wow. I'm now on biweekly Dupixent injections, which is helping tremendously. I have been to a number of specialists who have all chalked it up to hormones being the cause and that it should eventually resolve on its own. I don't want to be on this medication forever. What is your recommendation for postpartum health and eczema?
Great question. Multiple part question, great question. The overwhelming majority of patients I see, whether it's during pregnancy, before, after, or not, eczema correlates with allergy, delayed reaction to a food. So there are people that don't have a symptom when they eat the food, but within a few days after, it could be a week later, have that symptom. So I would do a screening test for allergy, intradermal skin test on the arm, to see if there are any foods that are positive, take those foods out. Also, during pregnancy, when your levels go up, and then after you deliver and the levels drop down of your hormones, that decline or deficiency of hormones can create a variety of really bad side effects, including anxiety, depression, panic, etc. So there may be a way in between to give you a little bit of one of those hormones, just a tiny amount, to stabilize you so you're not hitting the rock bottom. If it is hormone related, over time that should fix itself. I'm not a big fan of using medications unless you absolutely have to, but I'd like to figure out what else may be the underlying causes of the eczema and help with that in a more natural fashion as opposed to just relying on the medication. So it's hard for me to get a complete picture of what you're describing without more information, but I think there are a lot of other things to look at. All righty. Everyone's texting, calling in. 888-420-9272. We're here taking calls. This is fun.
Yeah. The YouTube crowd just loves it.
That's wonderful.
I know. And also the previous question you had answered, she had responded. She said, I probably will want to do the more in-depth testing you mentioned, as I haven't done it before. Thank you, doctor.
Yeah, it makes sense, I don't understand why doctors don't do a full thyroid panel. I mean, there's no reason why you wouldn't. Different doctors are brought up in residency in different fashion. Some doctors do a little bit, and a doctor like myself will always look at more things. Sometimes when the first blood test comes back, it's a big blood test, we'll do a secondary test if something abnormal is showing, like a autoimmune panel or autoimmune markers, a positive ANA. So we want to see whether that person has some autoimmune mechanism that's starting or beginning or not. On Instagram, you're seeing, and probably TikTok, 100 panel blood test, 100 blood tests. Honestly, it's not really showing you a heck of a lot. It's better than what traditionally doctors would do. But when I spoke to the staff the other day after I saw that, I said, let's get a count of all the different blood tests we do. It's anywhere, the initial blood test, between 215 or 16 and 230 things. So we're looking at the most. No one looks beyond what I do because there's really not much more to look at. Of course, if a person's got some specific, horrible medical, mechanism, there are tests that we don't do, and that may be reserved for an oncologist, a cancer doctor, or something. But to really learn about your body and look at the things we look at is ideal because it covers so much ground. Okay. Let's see what else we have. Interesting question, email from Joe about exercise. Joe in Brooklyn. So the question is, do I exercise before I eat in the morning? Do I take certain foods or vitamins before I eat? When should I drink my protein shake? Typically, depending upon the exercise you're doing, if you're doing cardio, you should do it without any food. Because eating food, your body's got to break that food down, etc. It kind of takes away from the exercise and burning fats and sugars. And you have to shunt blood over to your stomach and your intestines to absorb the food you brought in. So typically we like to tell people, if you're doing cardio in the morning, do that so that you're doing it on an empty stomach and you'll get a better result. For people who are doing weight training, some people need to have some food there to do the weight training because it's shorter duration of action. You're creating more strength. Your muscle's going to suck up all sorts of good things. There are some people who like to have a protein shake before they work out, some during the workout, and some after the workout. If you're having a protein shake before the workout, it should be a very thin, not a very thick shake, because the thinner shakes are easier to absorb. Isopure is a shake that looks like clear water, a little bit cloudy because it's got some, coloring in it. And that gives you 40 grams of protein. So if you have that before you work out or during your workout, it's going to get sucked up right into your muscles to create its effect. For people who like to have the Other shakes, it's probably better off after your workout, so it doesn't affect your workout. The bigger or thicker shakes are the ones that people like to use if they're trying to put on some mass. And foods, I think you want to have a lot of good proteins around when you're working out. Again, it also depends upon what you're trying to achieve. You're trying to get big, muscles, or guys that are pro bodybuilders. They'll eat a ton of carb before they work out. They'll eat a ton of protein before they work out, and they'll lift weights because they want all that to get into the muscle. But that's a very small percentage of the population. So the average person should do cardio on an empty stomach, and if they're going to do some weights to try to gain some strength and size, you could have something to eat.
So I have a follow-up question off of that from myself. So a couple of years ago, I switched to that intermittent fasting, right, where I would only eat from like 6 to 8 p.m. all of my calories for the day because I wanted to lose weight. And it worked so well. Like I looked great, but one day it kind of like my body must have gotten used to it, and I just started putting on like I had to change my regimen because like I feel like my body maybe got used to it, and it just I just started gaining.
Will try to adapt to everything that you do to it, and realistically, a lot of people having the Western diet here will have way too much for breakfast, way too much for lunch, way too much food for dinner, or they're having way more carb than they need to. And when that body's used to having all that and you can't get out of your own way, you can't get your weight loss result, cutting back on calories, which for research over many years talks about calorie restriction confers longevity. People typically live longer when they're not taking in tons and tons of calories. If you start the day, you do some exercise, and you feel good and you're not hungry because the exercise satisfies your hunger, and you're waiting till later to eat, your body says, okay, I see what's going on. I'm not taking all this stuff in to block the burning of the fats and the sugars. I'm going to burn the fats and the sugars. For some people that work out heavy, and do weight training or a lot of cardio, sometimes intermittent fasting is not enough energy for them to, do their exercise, but for a lot of people it is. And then bringing the foods in the evening can make sense because now you're giving your body sustenance. My only comment with intermittent fasting, a lot of my patients do it, is that you've got to have your vitamins there. And you need your vitamins on board, otherwise your body is going to suffer from having low vitamin levels, which is not good for your immune system, not good for hormones and a variety of things. So you want to have your vitamins on board. For some people, I tell them, have a protein shake first thing in the morning. You're not getting carbs from it. You can get Orgain. It's a great organic protein shake, and some people will put that in their coffee, drink it, and they won't eat until dinner. And they're still doing great. They'll still lose the weight. So it really depends upon that person's specific reaction.
What's this fad I'm seeing all of these different health people are posting on Instagram that they put some butter in their coffee? What is that, doctor?
So there's the idea that having fat in your diet, and similar to what was done in past with the Atkins diet, fat makes you full and you don't want or need to eat, et cetera, et cetera. But as this fad first started, I started seeing patients in my practice that had really high liver enzymes. I'm saying liver enzymes are elevated usually from infection or something bad going on. So sitting there and talking to them about everything as I do, and we talk about their diet, and their liver enzymes were good 3 months ago, I said, something's going on that's raising your liver enzymes. I'm not sure what it is. You got to tell me what you're doing that's different. Well, I'm taking the butter and putting it in my coffee. And I looked at them and said, why would you take butter and put it in your coffee? Oh, because blah, blah, blah. And I'm like, okay, from today forward, stop the butter in your coffee and we'll recheck your liver enzymes, in a week. And the problem was, if you put butter and heat it in your coffee and you drink it, you're putting a lot of fat into your stomach, which is going to affect your liver and potentially affect your blood vessels. Your blood vessels and your liver is not meant to have that much fat get into your system all at once. It's just a fact. You don't get hot fat in large amounts going into your blood vessels, and that would be good for your liver. So it does not make sense.
Thank you for clarifying that, because when I had first seen it, I was with a couple friends, and these friends are much fitter than me. So I'm like, dude, what are you doing? Butter in your coffee? And he's like pulling up his shirt. He's like, look at me. Look at you. I'm like, come on.
The problem is that there's a big risk from irritating or inflaming your liver, and they don't know that because they hear something, they hear a fad, and they adapt to it thinking, oh my God, this is a great thing. But for a lot of those people, it's a really bad thing. I had a patient once, lovely lady, who lived in the city, and she'd go down to Chinatown and buy teas and herbal things, etc. And she came in at one point, and she was horribly ill. And, no overt infection, sinus or otherwise, but she was just sick. So we did the full big blood test on her. We did the urine test on her, and we were looking at 21 heavy metals in the urine. She had huge amounts of arsenic. I said, wow, you've got a huge exposure to arsenic. I don't know where you're getting it from, but tell me, what are you doing that's any different? Well, I went down to this place, and I got some herbs, and they just took them leaves out of a, plastic bag that was sitting there in a barrel or something, and they told me to drink it 3 times a day. I said, and what was that supposed to do for you? I was supposed to detox me. And I said, what do you mean detox you? What are you detoxing? What toxins are you shown to have, and what is this thing doing? Is there any proof that this thing is grabbing the toxins, binding to them, and you could see that on a blood test, or you're pulling the toxins out and testing for them and watching them come out of your body? Of course, no. I said, stop the tea. I said, stop all the things you're taking from that store. And we also chelated her because we had to pull the metals out. She had other metals on board. Over the course of 2 or 3 treatments, she started to feel really good, and then we retested and watched her normals drop. So, got to be very careful what you take. All righty, you got a phone call.
You're taking
excellent
from that store.
Hi, how are you?
Also chelated her.
Hi, is this Frankie?
No, this is Dr. Calapai. Frankie just put you on the line.
Oh, well, hello there. I'm a good friend of Frankie and Sabrina.
Oh, great.
I have a question. I'm actually calling from the YouTube comment regarding the postpartum eczema.
Yeah.
So I wanted to just elaborate on that. So I know you mentioned getting a skin allergy test, which was actually something I had already done, and nothing came up positive.
How did they do that test? Just describe that technique for me. Did they do scratch or prick tests on your forearm or your back?
It was a skin patch.
Yeah. So there lies part of a problem.
So they put like little dots on my arm, and then I guess nothing came up positive from that.
Yeah, so that technique of allergy testing we don't ever do because it's not terribly accurate. When you put a patch on your skin,
right,
you're just touching the top layer of your skin, and the antibodies are not sitting on that top layer waiting to bind to something. They're deeper in your skin. So scratch test, prick test, patch, or even blood test where you're looking at a little bit of blood that's near the needle and that takes 3 seconds to fill the tube can have false negatives. It means it shows negative, but it may not be negative. The best test by all allergy society standards is an intradermal test where they take the tiniest needle and raise a little liquid bump in your skin up on near your shoulder area and let it sit there for 15 to 20 or 30 minutes so that your antibodies have time to get there to bind to it, and that shows a much more accurate technique. Now, if we take 5 foods and we test the tiniest dose we have, a very, very, very dilute liquid of those foods, let's say it's diluted 5 or 6 or 7 times from the original concentrate we get from the manufacturer. If you have no reaction, doesn't mean that you're allergic. If you do a second test with a slightly, stronger dose, maybe a dilution number 4, and you see a positive, then you're allergic, you take that food out. So it's a more accurate way to do the intradermal and then 2 different strengths.
That's amazing. That's
big difference,
definitely makes a lot more sense that would be more accurate. I did an elimination diet on my own, and I do feel that eggs and chicken is something that is a trigger for me. So I was very surprised that when I did the skin patch test that nothing came up for that.
Yeah, that's because those tests are easy to do, and et cetera.
Right.
And doctors can bill easily for 20, 30, 50, or 100 patch or tests on your back and that sort of thing. But it's not an accurate test. And doing the diet, changing it on your own, it's a great idea because you might hit upon things that you could take out and feel better. Everybody thinks, I heard about people being very allergic to nuts or to chocolate, or it could be any number of foods. That's why we test for different things. And for some people, chicken, absolutely, or soy or cow's milk, A variety of things can create that. But
what I ended up doing, I actually went on like a carnivore diet, which actually made me lose a lot of the postpartum baby weight. But I actually lowered my blood pressure to like a dangerous level that, my body was shaking. I was super fatigued.
Well, you've got to do it.
So after that,
you've got to do it with blood testing first, and then a diet based upon your blood test, so we can make sure you're getting all the nutrients you need, and you're not going to affect your body negatively. And watch to see those things improve.
Yeah, that makes sense.
There are a lot of people going on the carnivore diet because that's the latest fad. I think if it's done short term and you're getting your nutrients, you could use it as a way to help to burn sugar, burn fat, bring down the weight, but it's not, there's no long-term, diet there. I think you can use some of these things if it's medically supervised to gain some benefit, but then you've got to, go more towards a Mediterranean diet. But just about everybody I speak to, we get them off the grains, they feel like $1 million. Not only can people be allergic to the grain, wheat, corn, rye, etc., they could be allergic to the fact that there are chemicals in these things now, much more than ever before, or that they're GMO. And I have tons of patients that travel to Europe and South America that can have bread and pasta and, there, but they can't have it here because those are non-GMO pure grains over in Europe, Italy and France and etc. So...
Yep, I hear that all too often, how, people go to Europe and they can eat all the things that they can't eat, here.
And they lose weight, but here they gain weight from all these things because it's not a pure grain.
Right.
But
or they
hopefully
have,
with the new administration and RFK Jr.,
intolerance.
We're going to get all the junk out of the foods.
Yeah.
Thank
God for him.
Just love that. Wonderful. Thank you so much for your call.
Wonderful.
Yeah, if we could give
you so much.
we can help you out,
it.
give us a call again. Thank you.
Take care.
You too. Bye-bye.
Bye-bye.
So every day I talk to people about reaction to foods. It's one of the things I talk about the most, that and hormones, because it's what most people, are dealing with, and they're causative for a lot of different problems in their body. Okay, 888-420-9272 if you'd like to call in and ask a question, or text in or type in, or however you'd like to contact us, that would be fine. Telepathy is good too. But, it may take a little longer to get that through. 888-420-9272. We had another email in the office, and we spoke about thyroid. Donna had asked about low thyroid, how to treat that. So, of course, looking at all the markers for thyroid and correcting, we typically use either a compounded thyroid that's got no fillers, dyes, excipients. Hey, buddy, here's my co-host. You want to come on the show today? You want to come up? Okay. Lou, you have anything to say? Microphone? Say hello. Hello. You're such a sweetie. So we typically use compounded thyroid. We can use Armour thyroid or NP thyroid, and then recheck your levels over the course of a couple of weeks to watch to see how well your T3, T4 come up, how much energy, focus, concentration you have improve. So you have to make a list of all your symptoms and track them so we can watch to see your improvement through your symptomatic result and as well your blood test. DHEA, she also asked about. DHEA is adrenal hormone, and you release it in response to stress. So if you're really stressed out, you're probably using it faster than you can make it, so sometimes you can take a capsule of DHEA. That'll help to decrease your stress response. And then Peter asked about IGF-I. IGF-1 is the active component of growth hormone. We spoke about that a little bit before. But as that declines, memory, focus, concentration, hair, skin, nails, sleep, all these things are changed for the worse. So much more important to have that corrected than to let it continue to decline. Also, when you look at hormones, let's say that there's a category or a level of which... You want to get down? What do you think?
He wants a kiss.
Let's say every decade your levels are dropping, and then the lab test will give you a range of where you should be within that decade. If you're 50 or 60 or 70 and it's expected for your hormones or your vitamins to be low, that's not necessarily where you want to be. You want to be at a younger age to have better thyroid or DHA or testosterone or IGF-1 or better vitamin levels to bring your body back to the benefit you had before. That's a big picture that we talk about all the time. How are you doing? Did you just wink at me? I'll wink back. Good boy. Who's the WC Field said never do stuff with kids or dogs because they steal the scene?
Of course.
Okay. Phone lines are open if you'd like to call in or reach us, 888-420-9272. A lot of great questions today. The website is drcalapai.com, drcalapai.com. And we're here on the podcast going out all over the place. What do we have, 15 different platforms?
Roughly.
I don't remember all of them. I just
About
know that
14 to 16, somewhere in between.
YouTube, I think, is our biggest.
We got a
Spotify,
caller.
Pandora, Amazon. Another call? Excellent.
Hello, hello.
Hello,
Hi, it's
hello.
Dr. Calapai.
Hi,
How are you?
I'm good. How are you?
Great.
I think I might have popped in at the tail end of it, but you were talking about butter and the butter in coffee bad or whatever.
Yeah.
Just curious, how does it end up affecting your liver? Like, what's the mechanism?
You're putting hot fat into your stomach, and through your blood vessels in your stomach, it gets into your bloodstream, into your liver. You're also putting a lot of stress on your gallbladder because your gallbladder, has bile that goes from your liver into your gallbladder, and then it gets squeezed into your intestine if there's a lot of fat there, and it's putting a ton of stress on your gallbladder, which at some point can cause gallbladder problems or stones. So, yeah, you don't want hot fat to get to your liver. And again,
is that something that scales up, like, depending on the amount of fat that you're consuming?
Well, yeah, I'm sure the more fat
general?
you put into the coffee, or the more butter you put into the coffee, then you have a larger amount of fat that's going to present to your liver. I just don't see any dietary, or nutritional benefit of that. And of course, and I've seen this in more than a few people that we've checked their blood, and it's weird that their liver enzymes are up, and they didn't really change that much else. So we've come across it, and then of course after that was a couple of years ago. Every person I saw that had elevated liver enzymes, I would say, what are you doing with your diet? And ask them whether or not they're putting the butter in the coffee, and a lot of people were. And it reverses once you get it out. So
got it. Okay. You revert once you stop it. It reverses.
Once you stop it, it reverses over the course of probably a week to 2 weeks.
Oh, okay, got it. So quickly. Okay.
Yeah. Great. Thank you for your call.
Okay, cool. Yeah, I was just curious.
Thank you. Okay, phone lines are open, 888-420-9272 if you'd like to call in to ask a question. Website is drcalapai.com. You can see a lot of cool and groovy stuff on the website. Videos, articles. We talk about lots of articles. We're looking at another way to be able to show you the articles, maybe a overhead GoPro or a camera to kind of zoom in on some of these things, because it's a little unwieldy to try to hold them up. And
we got the YouTube chats chiming in. So is butter safer than margarine or those olive oil blended fake butters?
Well, butter is safer than margarine. Margarine is trans fat and is more damaging to your body and your cells. So butter is much more natural. However, olive oil I think is great. And if it's a real pure butter and it has some olive oil in it, that would be fine. But for a lot of people, I tell them olive oil is by far the best because olive oil helps to kill bacteria in your gut. It's just good for you in every way, shape, or form. And a lot of people, including myself, either at night or first thing in the morning, will have a tablespoon of olive oil and just let that get in and sit there. There's a discussion about olive oil can help to kill Helicobacter, which is a stomach bacteria that can, if left long enough, increases the risk of stomach cancer. So olive oil, the best. Pure butter, some people like to make it themselves, would be fine, but not margarine. And you could look up studies on this online. I've seen a ton of them.
What's the deal with I can't believe it's not butter? Like, are these just bad things to?
Well,
to
they're
consume?
trying to make something that tastes and looks like butter, but it depends upon what they put into it. I mean, I would just use plain butter, as organically as you can get. I forget the name of the butter that comes from Kerry's Gold, I think, is a butter from Ireland that's got terrific reviews and rave ratings. So I think the more natural, without preservatives or chemicals in it, would be fine. And then, again, as I've said before, a lot of people decide to make their own things. Make their own wine, make their own foods, make their own butter, make their own consumables. It just makes a lot of sense.
Yeah, it's just one of those things where, when I had a nice wife who was able to cook for me one day she's like, we had some extra what was it, heavy cream?
Yeah.
We had an extra heavy cream that was about to go bad, and then boom, she makes butter out of it.
Absolutely.
And it's the best butter we've ever had. I'm
Absolutely.
like, what are we even doing?
Absolutely. I think the trend now, which is a growing trend, and it will last, is a trend of people making their own food. As I've mentioned, take good seltzer water and you can make your own drink from that. You put a little juice in there. Doesn't have to be tons and tons of orange juice, which would bring up the sugar content, but just enough juice to make it taste good. There are great ways to make things, for yourself. And as we spoke about the garden device, GARDYN, where you can grow your vegetables year-round inside your house, is genius. And most people I talk to, I think they enjoy having a garden outside, but just make sure the soil is good, put all the good ingredients into it, compost it. Can throw some vitamins in there.
Right. We've got an Instagram question, continuing the butter trend.
Okay.
How do you feel about plant-based butter for people who can't use dairy products?
That's fine. Plant-based substances I think are great. And there are some people who like to use, either a spread or a butter that's macadamia or almond or cashew. I think that's fine. It's great. And the great thing also is that there are a lot of companies that are catering to making product that are great substitutes. So a while back, I spoke about this green sheet that we hand out to patients. It's got a list of all sorts of different things that you could use as substitutes. So we give this out to patients every day. So cashew milk yogurt is great for you. It's cashew milk. It's not cow's milk. And it's got 1 gram of carb in the plain cashew milk. You can put some berries in it and make a little smoothie. It's only 1 gram of carb. Adding the berries, you're not going to add much carb at all to that. If you put a good organic protein powder in it and mix it up, now you've got a smoothie with a protein powder. It becomes like a great meal and a great snack. So you could use that. And I do that sort of thing in the morning. There's grain-free bread from Julian Bakery on Amazon. Paleo-thin wraps that are made from nuts and seeds. There's no grain. Almond milk, grain-free chips and wraps by Siete, famous company. The almond milk is made by Califia Farms. That's a very big company. But Siete's terrific. It's a family-owned company, and I love chips and salsa. So good chips, good salsa. Lentil chips by Simply 7. Cauliflower rice, you can get that in any store now. You could mix that in a pan with garlic, olive oil, put in some tomatoes, peppers. You could put lots of stuff in there and have no grain, and that's to your advantage. It's great to do on a low carb. Grain-free crackers, almond flour, zucchini and squash pasta, guilt-free pizza. Excuse me. It's made by Low Carb Life. It's cauliflower crust pizza, Viking protein waffles, grain-free pasta, skinny pasta. It's made from konjac root. Looks and tastes like rice or pasta, but there's no grain. Cookies, Emmy's Organics, grain-free, gluten-free cereal, 7 Sundays. It's made with nuts and seeds. So there's a lot that you can utilize and substitute, and you're not really missing anything. So it makes all the sense in the world. Once again, 888-420-9272. If you'd like to call in to ask a question, you could do so. 888-420-9272. A lot of great calls today. I keep thinking back to so many years of doing the radio. And as I say, years ago, the calls, were, why do I need vitamins? Why should I do this? Why do I need exercise? It was a little bit more work to try to get people to think and broaden their horizons, expand their thought process. Now people call in with amazing, complicated questions.
Yeah. Seems like people are just much more educated on all the things.
Yeah, and they want to learn. And in part, because everything now is at your fingertips that wasn't before 20, 30, 40 years ago, 50 years ago. You can gather information on anything in a second. And if you want to look at why is this bad for me or why is this good for me or what should I do, that information is there. So people are accessing information like never before, which is a good thing. And I think the mechanism of AI used the right way is a great thing. So we'll watch and see how that all pans out. But it's important for people to have an inquisitive nature and want to learn and understand and adapt these things for their own personal health and their own environment.
And just a shout out to you, because I didn't know what Google Scholar was.
Oh, yeah.
And what a powerful tool.
Yeah.
Even
wonderful.
through, I did psychology classes in college doing, all these different citation programs.
Sure.
Not once were we taught about this. Incredible.
Well, so many years ago when I first started in the computer screens, or the computers were just so rudimentary, just beginning, Health Database Plus was the first and only real database that had some cool health articles on it, and it grew and got bigger and bigger. Of course, it was eclipsed by all the big ones now, but I used to get on that computer with the modem. It would take like 10 minutes to get the modem to get the modem to connect, and then I would just search things, and it was great. There was also a guy in, not sure if he was in California, a PA. His name was Kirk. I forget his last name. But he was putting together great articles that he'd find research, and he put it together, and, you would connect with him, and you could research different articles and different topics. It was heavily nutritionally oriented. I have to figure out his last name, but he did a great job of putting this information out there. And then sooner or later, as Google came on and everything else, Google Scholar is the easiest. I tell every single patient, go on Google Scholar, look at the literature. But very, very important. Alrighty. Another great show. All set and done. Thank you for listening, watching. Thank you for calling in. Some terrific, terrific questions. Give us a call at the office, 516-794-0404 if we can help you. Website's drcalapai.com. And we'd love to hear from you. Thank you for all your emails. We are getting back to your emails every day. Myself, Mindy, my PA, and Donna, my office manager, as I see and read the emails, will answer you as quickly as humanly possible and get to help you as best we can. Thank you. God bless you all. Have a terrific